log in with my password and set up a patient in the usual fashion. So I'm going to pick the clinic, select Add New Patient, and I'll put in some basic information, including first and last name, again, just like we would with any other patient. Patient ID, gender, we still have a choice of English or Spanish, and then date of birth. Email address option is still available. If you happen to have internet available for your patient, you can certainly utilize that, again, like any other episode. So the next step will be that I'm going to select the clinician, and then for our care type, what we'll see is that we certainly have neurological. We also have speech, and that would work for speech only, although it's not quite as developed at this point because you still have to do the FOTO functional measure even if the patient is speech only. But it certainly will work. It'll generate the functional limitation modifiers for Medicare patients. I put in the primary clinician. Again, I've got my choice of care types, and so I might be using neurological. I might be using speech if it's a speech-only patient. If you observe that you do not have some of these care types on your drop-down list, there's a field in the administrator area where they can be enabled or disabled. And so chances are if you don't see one of these care types, it's been turned off in the past. And you can contact certainly our support team, and they can assist you in getting it turned back on to make sure it's available. For me today, I'm going to envision that I've got a multidisciplinary stroke patient. And so you see I select neurological care type, and then the impairment would be cerebrovascular disorders. You notice that body part is removed because that's not how we classify this population. You'll also notice if you don't use the impairment categories a lot that a description appears on the right-hand side that is going to help confirm that you've selected the right impairment category. In addition to that, you've always got access to the resource center. You can see where I am over here on the left, and that has a full list of all of the impairment categories tied to the actual ICD-9 codes. The next step, we're going to select the payer source, and I'll go ahead and address that we do have adding the functional limitation reporting information for all care types as a default setting that you can select. I believe it's moved to be the next priority on our priority list. We're getting lots of information that I think the state of Texas is now requiring functional limitation reporting for work comp patients, and so there's a lot of push for that, and so please know that we plan to address very quickly so you see the functional limitation reporting information if you want for any type of payer you select. And so then I get down to my optional surveys. And in this, we're very pleased to show that we have the stroke impact scale communication component, and we also have another tool called the NeuroQual. The NeuroQual was developed by the NINDS, the National Institute for Neurologic Disorders and Stroke. It utilizes computer adaptive testing like the standard FOTO functional measure. And so what I thought I'd do today, and as always it's open for discussion, is that I would add on first the stroke impact scale and go through so you get a truer sense of the length and the way that that would flow. And so with that, and then I'll do another intake that adds on the NeuroQual. Again, because you would rarely want to use them in conjunction, you'd want to select the one that you like the best. And for me today, I'm going to just add on the stroke impact scale. And so then I create the episode. As always, we're now finished with the setup process, and I can come in and select my continue button to begin the assessment. And so we've got the usual instructions available, and we'll simply select begin. And now it's going to start with the FOTO functional status measure. This is the usual tool that we use for general medical neurological patients. We're going to find that it covers PT-OT areas, and then we've added on the speech component. Certainly an area that we're moving is if the patient was classified as speech only, removing this portion, but we have not got that available yet, so it would give these questions even if the patient had been classified as speech only. And so the first question is, does or would your health problem limit walking 1 block? And I'm going to say that I would be limited a lot with that. And so then it asks about walking around a room. And I'll say I'm limited a little there, and completing your toileting and getting in and out of a chair. And so that was our standard FOTO functional status measure. Now we've moved on because we've added the stroke impact scale, the communication component, and it's going to ask these questions. And bear in mind, the stroke impact scale does not utilize computer adaptive testing. So every time we see this tool, it's going to give us the same questions in the same order. And I would not rule out that someday we'll have enough data to create computer adaptive testing for it, but just bear in mind that that's a different nuance than the other tool. And so for us today, we have in the past week, how difficult was it to say the name of someone who is in front of you? And how difficult was it to understand what was being said to you in a conversation? And how difficult was it to reply to a question? And to correctly name objects? How difficult was it to participate in a conversation with a group of people? To have a conversation on the telephone? To call another person on the telephone, including selecting the correct phone number and dialing. So we see a wide variety of communication activities, a very varied level of difficulty, and that completed the stroke impact scale communication component. And then we're going to answer the same information that we do for any patient going through FOTO, which is, what was your exercise history before this condition? Have you been treated for this condition before? Are you taking prescription medication for this condition? And then our typical risk adjustment factors. How many surgeries have you had for this problem? How many days ago did the condition begin? And what other health problems do you have? So all very familiar. And we'll select our health problems. We do ask for height and weight, and if BMI is greater than 30, we count that as an additional health problem. And then we wrap up with an item from the Fear Avoidance Behavior Questionnaire. And this is interesting because studies have been done on a neurological population that have shown that even though they may not have pain as a result of their condition, that patients answer this in a consistent way that brings value in terms of measuring fear overall. And at that point, we are finished. The report, just like any of the others, is immediate. And I'll just simply pull it up on the screen so we can take a look at it. And so this is our functional intake summary. And what we'll see at the top left is that our patient identifiers have been listed. Over here in the risk adjustment criteria, this is what the FOTO comparison has been risk adjusted by. Now bear in mind that this is not going to go through, this is not going to be used in the scoring of the stroke impact scale. It's only in the FOTO functional measure. This report is available immediately as long as you utilize the Outcomes Manager subscription level of FOTO. You can set an auto print, or you can certainly open it up here and just go down. There's a little print icon, and so you can print it right out, take it with you, and have it to make notes and look for other information. Okay, so we've gone through identifiers for the patient and the risk adjustment factors. And again, the risk adjustment factors are used in our predictions for the functional status measure, but they will not be used in calculation of the stroke impact scale. Now, however, you know when they talk about functional limitation reporting, you want an assessment, but you also want clinical judgment and consideration of the patient's overall health. Well, this is really great because you've got all of these risk adjustment factors outlined. When we get down to the patient-reported information, you can see what other health problems they have, and exercise history and prescription medication. Bringing all of that together into your clinical decision-making process really simply. And so for us, for the functional status measure, again, this is Based on the FOTO measure, our patient started at a 40. Today, we expect 21 points of change and 29 visits and so on. But the real thing that we're here to see is the stroke impact scale. And so what you'll see is that our first G codes come from the activity G codes. And we're going to see the usual layout of the G codes and the severity modifiers. But now, because we added the stroke impact scale for communication, what we're going to see is that we've also outlined that. And so now we've got the percent score for intake. We have the functional limitation items that were asked, how the patient responded about how difficult it was, and the G code to which those relate as well. So it's very similar to the layout of the other information. And we also include the, and up at the top you see where we've got the percent score. Well, just like with the FOTO functional measures, we need to translate that into the percent limitation. And so we indicate the G codes, how many items were asked, and then we have the G code for the current status, the goal status, and the discharge status. And we've got the intake, level of function, translated into a level of limitation, and the severity modifier. So you'll notice that we are not able to indicate goal status like we are with some of the other measures because we don't have the data to make those calculations, at least yet. So for that, you would use your clinical judgment. And so with this, we've actually got all the different G codes and just a couple of new things. And this is not exclusive to the communication components, but we've got a lot of clients here, and I think it'll be of interest. You may have noticed that this discharge status column has been added very recently. The reason for that is if you have a one-time only patient. In that event, you have to put current status, goal status, and discharge status on the claim at once. And so we added this discharge column so it would be right at your fingertips if you need it for that purpose. And you'll notice down here it indicates only report if this is a one-time visit, and it also puts that up here. And so again, we hope a really clear, clean way to display this information to assist with the clinical decision-making process. And so I'll select my back button and it'll take me back into my support staff home. And so that's basically the way that the assessment rolls out. The status would be like it is with any other population, that it's going to give the functional status measure, and then it will also do the stroke impact scale in its entirety. And so we won't go back through that yet. So now that we're going to set up a new patient, or let's set up a new episode for this patient. It's no different. It just saves us a few keystrokes. I'm going to select the clinician once again. We're going to select the care type. And in this example, we are going to do a NeuroQual communication assessment. And so we'll simply classify our patient, select the payer source. And so we go down through our usual list of optional assessments. And so with this, it is interesting too, though. You'll notice that the stroke impact scale has a component for memory, mood, emotions, and then you've got activities, hand function, mobility, strength, social participation. Almost the same kind of thing when we get down to the NeuroQual, fatigue, ability to participate, positive effect, upper extremity, lower extremity, and then what we're looking for in this case is communication. Again, all of the components of the stroke impact scale and the NeuroQual are going to generate the functional limitation information. And so I've added on my optional assessment, and again, these can be pre-selected or just added at the time you set up the episode. And so I'm done with the setup. And I'm just going to select continue, and it'll take me into the assessment. So once again, we're going to see the instruction screen. We are anchored with the FOTO functional status measure, where we're going to respond about how difficult certain activities are for us. And then we close with, or not close, but with the usual additional information items that we gather from each patient, additional treatment. Are they taking prescription medication? How many surgeries have they had for this problem? How long have they had the condition? What other health problems do they have? Excuse me. And we do gather height and weight, so this is all the same as we saw in the last one. And I'm going to rate my fear avoidance. And then now we start with the NeuroQual communication component. Now realize here that we are using a tool that utilizes computer adaptive testing. So as my patient responds to the questions, it's going to guide the assessment just like you're used to in the usual FOTO functional measures. So the first one is, how much difficulty do you currently have writing notes to yourself, such as appointments or to-do lists? And I'm going to say I have a lot of difficulty with that. And then it asks me, well, how much difficulty do you currently have understanding family and friends on the phone? And I might say somewhat there. And how much difficulty do you currently have carrying on a conversation with a small group of people, like family or friends? And I'll say maybe somewhat with that too. And how much difficulty do you currently have organizing what you want to say? And I'll say I have a lot of difficulty there. And do you have speaking clearly enough to use the telephone? And that concluded the assessment. And so we're going to log back in. We'll see our feedback. And so we'll increase the size. Now again, you're seeing all of the standard information from any FOTO report. Again, pointing out that you've got a lot of valuable information in considering this patient's overall health when making the decision about your expectations for them. Now, one thing that is interesting and different with the NeuroQual is that, number one, they're not 100-point scales. And number two, the score that you see relates to the construct being measured. So in communication, that's a good thing, and so higher is better. If we were measuring something like anxiety, which is not considered positive, lower score would be better. So it can be a challenge to make sure you're interpreting it properly. And so what we did for NeuroQual is we give the score, but then we give you the range. And so you see from worst to best what the range is for that actual score. And then, just like in the other tools we've examined, we're going to see the questions selected for the patient, where they're having a lot of trouble, and the G-code that relates to. And once again, we've provided the G-codes with the third one for the DC, just if this is a one-time only. We have taken the intake score of 13. We've translated it into a percent limitation. And you see that that's based off the raw score scaled 0 to 100. And we've provided the current status and the discharge status only if this is a one-time only. And so, again, some really nice, well-developed, well-researched tools that are available. I'm going to go through and do a status for this patient because the assessment may not be exactly the same, and I think that might be of interest. And so I'm simply going to select, and I guess doing a patient with the same condition wasn't the easiest way to pick out the correct one, but I can see here that I've added the NeuroQual, and I'm just going to add a survey and log in. And again, this will be, I'll go through the functional questions for FOTO pretty quickly because these are not new. And so we're going through, and we answer about prescription medication usage. We've got the satisfaction responses. And so I'm just going through satisfaction. And now we're going to get to our actual NeuroQual assessment. And so now it's going to ask me, well, how much difficulty do you have writing notes to yourself, such as appointments or to-do lists? So you notice, just like the FOTO measures, it anchors it with a question that is the same at the beginning of each. Well, what if I say now that I have only a little difficulty rather than a lot? And it asks about understanding family and friends on the phone. And maybe I'll say I don't have any problem. And carrying on a conversation with a small group of people. And organizing what you want to say. And speaking clearly enough to use the telephone. And so that concludes the measure. Just like the rest of the photo reports, it's going to immediately provide the scoring on that. And let's see here. And so again, we've got all of our measures and G-code information, our various severity modifiers, and the other information. So we're able to see that we have an intake measure and then one for today, providing that information. And so again, just to kind of recap, this is in your basic system to be added on as you wish. It functions the same as the others, meaning that you can pre-select or deselect, however you want that to go. Again, one area where we can improve will be in the speech-only care type, because it does still anchor the communication tools to the standard photo functional measure. And, the interesting thing here is, who knows? We may get in a lot of speech data and really be able to move forward and refine the systems in the way that we have with our other tools. And so we're very hopeful that we can provide a much more multidisciplinary set of tools for our clients. And this is interesting, and it's a good question. Since swallowing is not a component of FOTO, do we use the other G-code? And with that, I would say whatever is the most important with the patient is the G-code to use, and you may, until we have something available, want to use some other type of assessment. Let's see. And I've got a question that says, when I use the NOMS, and NOMS is the Outcomes Measurement Tool from ASHA, certainly we hoped very much that we would be able to include this in our system, but it just hasn't worked out that way. So when I'm using NOMS, I'm using my skills to determine the level the patient would be. With the questions here, this will depend on how the patient answers. If they have cognitive challenges, they may not be reflecting what is accurate. Absolutely. If you have a patient with a cognitive impairment, there are absolutely concerns in their ability to accurately report. In that case, you do have, and again, to be clear about what is meant by proxy, is a family or a family member or a caregiver, someone who's been around enough to respond based on their observation. Certainly, sometimes that may not be a possibility. In the FOTO world, similar to NOMS, we have the clinician-driven ADL assessment that is available and could stand in, and will calculate the G-codes and the modifiers from the ADL. Again, we've got another session planned on that to kind of expand the information that we're sharing about the other options that are out there. And so like NOMS, you could do the ADL assessment from the clinician perspective. And in that, it's really neat because you rate on for communication, it's a 4-point scale. You rate where the patient is and set a goal, and we translate all of that into the functional limitation information. Yeah. Really, while we do, and pardon me, the question here is, so if a patient arrives with a swallowing condition, we should use a different survey, such as a paper survey, and not use FOTO. And I think, yeah, in that circumstance, because we don't have a tool that addresses swallowing, you would be better served to do some other kind of tool. And then perhaps suggest it to us so we can see if it's in the public domain, and we might be able to assist with that in the future. All very, very good questions. So that's really all I wanted to cover today. And again, just trying to expand the assistance that we can provide and trying to bring real value to multidisciplinary treatment settings. As always, everybody here on the FOTO team is here to assist. Well, thanks so much. Have a wonderful day.